Across the world, businesses are suffering record losses. People are staying home. They're not going out. They're not getting entertainment. They're not going out to eat. This has caused a significant reduction in the amount of fuel that's being used, which is spectacular for the environment, but has been obviously terrible for oil businesses, oil companies. The price of oil is at an all-time low. Delta Airlines has reported that they have seen a 90% drop in revenue for this quarter. It seems businesses all across the world are doing poorly. The internet is suffering a significant overload, for lack of a better word. So many people are using it. Companies like Disney, Google, Facebook, Twitter are all having to throttle their bandwidth, especially to streaming services. This show hasn't been without consequences. One of the things that YouTube's been having problems with is, even if you have liked this channel, even if you've rung the bell, and we hope you will do both of those, but even if you've actually rung the bell and said that you would like to get notifications, it appears anecdotally we've learned that only about 10% of those notifications are actually going out right now. There's just so much going on, and the YouTube servers, which are managed by Google, can't keep up with the traffic. And this doesn't necessarily translate to an increase in revenue. In some cases it does, especially where they're selling advertising, but people are actually cutting back on their streaming services. They're cutting back on non-essential services. They're cutting back on the speed of their internet because, well, we're all relying on our internet now more than perhaps we have in the past. The reality is we're also all trying to save money. And so people are not spending it if they don't have to and saving it for necessities like food and gas and rent. This is with one exception. There is one website which has seen a dramatic increase, not just in views and how many people are going to it, views and traffic, but also in terms of subscribers. That website is Pornhub. Pornhub has seen a dramatic increase in usage, presumably for the articles. And you can see, interestingly enough, the spike in usage as individual countries and states are locked down. Now, this is across all demographics. It doesn't matter race, gender, sexual orientation. They're all having a similar spike as states receive lockdown orders and people are forced to shelter in place. That's fine. Whatever floats your boat. That's perfectly cool. I do think, a number of people are paying for the premium on Pornhub. And what they're not doing is realizing that every 8 to 12 months, Pornhub actually does a $300 lifetime subscription membership. Now, that membership, if you buy that membership, that actually pays for itself in 7.5, 8 months, according to the New York Times. Is it getting hot in here, or is it just me? Hello there. Welcome to In Time. My name is Nicholas Lamar Soutter. It's been a little while since we've had one of these updates. I apologize. We have people who get their news almost exclusively from us. My condolences. It's a privilege and an honor to be able to try to bring clarity to any number of events, this one among them. Unfortunately, I have been rather ill myself, so I was unable to broadcast for a while. I'm not yet recovered, but I'm recovered enough. A lot's been going on, obviously. It's continued to, and our other shows have been continuing, and I have been able to make appearances on some of them. It's easier to do that than this. The Stitch in Time, Mikey is doing a spectacular job. That's a great show, and not enough people who watch this are watching Stitch. It's a spectacular program. I hear he makes fun of me some, and we'll get to that somehow or not. I will get him back. But in the meantime, we've also had on sort of our regular course of guests. We've had on Cyrus the Skeptic, Richard Carrier, Godless Mom. Godless Mom was a while back. Joss Martin, and we'll be having on Shannon Q and a few others in the coming weeks. We look forward to all those shows. We're going to continue to do them, but we're also going to be getting back to our breaking news. To be honest, because of the nature of what I do, I'm often asked, what's the prognosis and what are things looking at? I'm not much less in the dark than most other people about that. I look at the numbers, I see what's going on. I do my best to make heads or tails of it. Sometimes I'm somewhere close to the mark, sometimes I'm not. I do know that we are not yet through this. It looks pretty clear to me that we're closer to the beginning than to the end. We haven't hit the middle point in this. New York is going to be the start of that. The U.S. is now the center of the global pandemic. We have more cases than anywhere else in the world. We are not as bad as Italy. New York will get there. Everything that can be, not everything that can be done, we'll get into that. A lot that can be done is being done. It's being taken reasonably seriously now by the federal government, but New York is already in a state of crisis and triage. They have far more patients than medical beds. They have an overwhelmed ICU system, and at this point, if memory serves, and I haven't looked at these numbers in a little while, but the ICU numbers were pretty bleak. About half of the people going into ICU were actually, I think it was 80%. As I recall, it's 80% of the people going into ICU were dying. And it's going to get worse. The reason we know it's going to get worse is because A, the lockdown hasn't been followed as well as people would like, and B, this has an incubation period, so even after the lockdown, there are infected people that are going to start to show symptoms and then start to get to be in a highly distressed state and need medical intervention. The latest numbers show, if I recall, that now they're looking at the peak number of losses for New York to be roughly 2 weeks away. We've got some idea now as to how this is progressing. It looks like, at least in New York, the number of people dying is doubled every 3 days. Every 3 days, the number of cases are being doubled. That's what we mean when we say logarithmic. So it's just every 3 days, significant. You're doubling the number of people who are dying from this disease. Nearly 3,000 New Yorkers have died, 600 in the last 24-hour period. This is now greater than the number of New Yorkers who died, actually the number of people who died total, if I recall, in all of 9/11. And the number of confirmed cases went up 10% last night alone. If we in the United States had acted quickly enough, we could have dramatically reduced the losses that we're going to suffer. We can't stop it. There's nothing we can do to stop it. There's going to be losses. But if we had been aggressive early on, we would have seen significantly lower numbers than we're going to see. The question is, how many numbers are we going to see now? We don't know that. That's because we still don't know the mortality rates as well as we'd like. There's a lot of conflicting data. There's deaths from ancillary problems, sort of other issues that come up as a result of this. We're going to get into that in a few minutes. It's very hard to know how many people are going to die from this. It's easy to know that it's going to be more than it could have been. Part of this is genuine incompetence and mismanagement and wish thinking over just cold rational thought on the part of leaders across this country. Donald Trump has said repeatedly that he expects this to be over reasonably soon, and that the damage to the economy would be too severe to continue the quarantine as long as scientists think it's necessary, because if they could, they'd quarantine the whole world. A number of pundits, no small number of them on Fox News, have said that, well, they're patriots, and so they would give up their lives so that their grandchildren could have a good economy, and so that they think everything should go back to normal. Current White House estimates are that roughly 240,000 Americans will die as a result of this pandemic, but those same estimates have said that as many as 2.2 million, 3 million, 4 million, 6 million, 9 million could die if we do absolutely nothing, or if we had done absolutely nothing. Between 2.2 million, the conservative White House estimate, and some estimates as high as 9 million dead Americans. Trump has equated this literally to car accidents. Well, Americans die on our freeways all the time. It shocks most of people that I speak with about how many people actually die on our freeways. It's usually between 42 and 52,000 a year. That's actually quite a lot. 42 and 52,000 people a year die on our freeways here in the United States. A lot more, by the way, than died in 9/11. But at any rate, it's a pretty high number. But that's in a year. 2.2 million in a couple of months? And he says they're the same? This is what the President of the United States has suggested. He has a complete disconnect with the reality of this situation. Those are his own numbers. The lowest estimates were the White House numbers of 2.2 million deaths if we did nothing. If we just proceeded as if nothing was happening. 2.2 million. But hey, 52,000 people die a year on our freeways, so everyone's kind of overreacting to this. Then Jared Kushner came out and said that the strategic stockpile of medical supplies that belongs to the United States actually belongs to the United States. It belongs to the federal government and is not for use by states. This is odd because A, that's never been the policy, and B, that's not what their website says. Their website clearly says it is for use from this, for the states. It's always been for use from the states. Hours after he misspoke and said something that factually was not true, the website was changed from that to this, to reflect what he had said. He was wrong, but rather than correct himself and to spare him the indignity of having been wrong and having been exposed to being in a position perhaps for which he was unqualified and knew nothing about, rather than have him that tragedy, that was spared. And instead, the policy has been changed, policy on which states have built their stockpiles with the assumption that they would have access to. They will now be denied. States will not be given, according to this change and according to Kushner, the supplies which they are entitled to, because those supplies aren't available. Oh, they are available. Because they were never entitled to, oh no, they were always told that they could have those supplies. They will be denied those supplies because he misspoke and he doesn't want to admit he was wrong. Kushner also reiterated that, of course, states will get what they need, and in fact, just as Trump has been saying, they are not actually taking aggressive action because they want states to decide for themselves. A number of problems with this in Texas. In fact, there's been this problem where a number of counties have said that they wanted a lockdown, but the lockdown is ineffective county by county or city by city because it's porous. People can just go in and out. It has to be done statewide to have any efficacy. So they've been waiting, and governors have been in a few rare cases now, failing to do so. Trump is, however, failing to do so, and he is using the argument that states know best what they need. I agree with that argument. I think there's some truth to that. What I find odd is then why is it that when Governor Cuomo said, we need this many ventilators, he was explicit, said exactly how many they needed. Exactly. Kushner came out and said, no, New York does not need that many. My top secret super special spies and this ethereal nebulous group of people who apparently have better information than the city of New York as to their needs has explained to Mr. Kushner that New York needs significantly fewer ventilators. I am thrilled that he was able to update Governor Cuomo as to what his needs actually are. Very kind of him. Georgia Governor Stacey Abrams came out and said yesterday that he just found out that you can actually transmit this disease without showing symptoms. That's the problem. If you were only contagious when showing symptoms, then the second somebody had a sniffle, you isolate them and you're done. This would be a very easy fix. The reason the world is in a huge fucking panic isn't because they're stupid. It isn't because they didn't realize that you could just isolate them after the sniffles. It's because this is a serious fucking problem. And perhaps governors, if they're going to be representing their people in a worldwide crisis, should understand the virus before enacting or denying legislation or methods of containment. They should understand it before doing that so as to maybe save some lives. That is one of the cornerstone and most fundamental aspects of this disease. If you did not know that people were contagious, in some cases the estimates are about 4 days before they show symptoms, you are not qualified to render any judgment as to how people should deal with this problem. You're not qualified. You don't understand even the basics of what this disease is and what it's doing. This is a governor. Donald Trump has repeatedly said that there are medicines that he believes in his gut are going to be, at one point he used terminology similar to silver bullet. It's just going to be, that's it, we're done. This is going to work so well. He has suggested using antibiotics to cure a viral disease. I'm glad he knows so much, because there isn't a single scientist on the planet, not one, that thinks that you can use antibiotics to cure a viral disease. I know someone in the live chat's going to correct me and say you can use it as an adjunct because of XYZ. That's an adjunct. You can't cure it. Antibiotics have no impact on viral diseases. Viral, fungal, bacterial. 3 kinds of diseases. The cures for one have zero impact on the other. It's like trying to put out a fire with Oreo cookies. Oreo cookies are great for hunger, not very good for fires. But he continues to give out misinformation, said that these two medicines could maybe be a cure. You know what? People need hope in times like this, and I've been accused on occasion of having broadcasts that are bereft of hope, and maybe true, and maybe I can work on that. But false hope is dangerous in situations like this, because what happens is people say, oh, I hear there's a cure. Trump came out, and maybe the people who heard Trump heard it right. Trump said maybe there's a cure, but they tell someone else maybe there's a cure. Someone else tells their friend, I heard there's a cure. They tell her, oh, did you know there's a cure? That's a game of telephone. And it goes from Trump saying, I believe in my gut, which is never wrong except when it says something. I believe in this gut that this will be a cure. There's zero evidence. Zero evidence. None. Pick a drug off the shelf at CVS. There's as much evidence that that drug, I don't care what you picked, there's as much evidence that that drug is as effective as the other. That's how much evidence there is. Literally. I'm not making this up. But in his gut, he knows somehow. And people go around, did you hear there's a cure? Wow, great, so I can go on spring break. It's one reason everybody's been going, and the beaches are being closed. That's great. But when you think there's a cure, you don't take the precautions necessary. It's moral hazard. It's the original. It's closer to the original use of moral hazard as it was used in insurance. But nonetheless, it's moral hazard. When you don't think you're going to have to suffer the consequences, you behave more recklessly. If there's a cure, people aren't going to obey the lockdown. The problem is there isn't a cure, and even suggesting it when there's no evidence is fucking dangerous. He has said we won't have to worry about this very long. He keeps setting artificial dates. His gut tells him when this will be done by. This is the same gut that told him this would be nothing and would be gone in a week. Told him that, it wasn't 3 months ago. It was a month and a half ago. His gut told him that this was nothing. Then he came out and reminded everyone that he knew it was a pandemic before the World Health Organization did. I love his gut. It's amazing. Then he's been coming out and saying, well, would like to have it done by this. It will be done by this. He has said April will be a beautiful, beautiful month and has repeatedly said that it will be done by or in April. It is now ostensibly in April. So he thinks we're going to be done by April. There's absolutely no scientific map projection of this that suggests that New York will probably be through the worst of it by then. New York is about to have a very bad 2 weeks. After that, things will start getting better for New York. It's going to start getting worse for the rest of the country because there's plenty of parts of this country that hasn't locked down yet. They're not seeing numbers. People in Texas. Trump has also said there are many states that don't need to lock down because they don't have a problem. That's probably not true. They probably do have a problem. But because of the incubation period, they don't know they have a problem yet. That's why so many states have been locking down late. That's why so many countries locked down late. Because they weren't forward-thinking. They were reacting instead of being proactive. Those states may or may not have a problem. The likelihood is that they do have a problem. They just don't know it yet, and the evidence we're starting to see suggests that they have a problem. But let's assume that they don't. Good. Lock down. That's the only way to keep them from getting a problem. If they don't, they'll get one quick. I don't have to be an expert in virology to know that. What we're going to see is this. This is my prediction. Right now, nobody's saying this, but right now this is a liberal disease. The way we know it's a liberal disease is because it's only hitting the liberals. It's hitting the coasts. It's hitting the big cities. I had this discussion once before. Where does neoliberalism come from? Which is kind of the opposite of what people would think it is. But at any rate, conservatism, what's the difference between it? It doesn't matter. Let's just get... Universally, throughout time, cities have almost always been more liberal than the countrysides. The more urban the area, the more liberal it is. There are a lot of reasons for this, and a lot of them are very good reasons, not the least of which is it's pretty hard to be homophobic when you're in a huge city and you're encountering gay people all the time. You can still do it. There are people who do it. Prejudice runs pretty deep. But when you're forced to work with people that are different than you tend to open your mind up a little bit. Cities are always more liberal. They're also the first ones to get hit by diseases because they got the most number of people and the highest number of contact. That doesn't mean that the country isn't going to get hit. It doesn't mean it isn't going to get hit hard. It just means it's going to take longer. Right now, it's the blue states that are getting hit. It'll hit the red states. It will. Then, my suspicion is you're going to see another tune from this administration and a bunch of other governors who are then going to be worried about protecting their lives. But right now, they're worried about protecting blue lives, and they're going to expect the states that have already gone through this to assist them when right now Kushner is saying, nope, we don't give blue states, states, the medical supplies they need. What do you want to bet? If this hits Texas the way it hits New York, those supplies are going to start to open up. Which way did Texas vote in the last election? I don't mean to be cynical, and I'm usually not, but I have a very hard time not understanding are understanding this in much of any other context. Either that or they just enjoy watching it. Currently, the only states in the Union that do not have a stay-at-home order or larger is South Dakota, North Dakota, South Carolina, Utah, Iowa, Arkansas, and Nebraska. Wyoming has issued one. They're not under effect yet. It looks like it will go into effect on Monday. Now, Trump has said these states know what they need. Our president doesn't know what we need, so no, I don't have much. And if these states are run by governors that think that this thing can't be, you can't catch it if somebody's not showing symptoms, then no. The leaders of these states don't have a fucking clue about what they need. None. And the experts are trying to tell them, but yeah, their gut knows better. Meanwhile, conspiracy theories abound, and that's fine. I've seen my fair share of a few here. I do treat them with some significant hostility, and there's a reason. One interesting conspiracy theory is that the World Health Organization is being bought and paid for by Big Pharma. I got privileged, I've heard this one once or twice, but was privileged to catch it reasonably up close by someone who presented a list of how the World Health Organization gets all its money, and turns out almost all of the top donors are actually countries, including the U.S. at the top donor. 80% of their money comes from donors, but when it's the U.S., North Korea, UK, Italy, South Korea, yeah, it ain't Big Pharma. They don't provide 80% of it, but you go around saying that, and people, his argument, and the argument I've heard before, fine. I don't mind these arguments, I really don't. They are bought off and underreporting this disease. If you can substantiate that, fine. I'd love that to be true. They're overreporting the disease to scare everybody and sell pharmaceuticals. Apologies. Okay, I'd love that to be true. A, it would be less lethal. You'd have fewer people dying. B, hey, prove it to me and I get to report it and we get to break it on in time. You got my vote. But you have to support it. If you don't, that's not the same thing as yelling fire in a crowded theater. That's the same thing as being in a burning building and saying that the fire alarm is just somebody's phone and you shouldn't listen to it. It's an April Fool's joke. That's what that is. They're not getting bad yet, but some guy in Los Angeles, the medical ship Mercy is in Los Angeles. Somebody has decided that this is the symbol of the deep state. Big part of Trump's platform. This was actually a pro-Trump conservative member of the, I forget the QAnon, who decided that he had to destroy the Mercy in order to show this conspiracy. He hijacked a train and tried to derail it into the ship. He was short by me eyeballing and guesstimating it 300, 400 yards of the water line, let alone hitting the ship. I'm really glad a lot of these conspiracy theorists aren't all that bright. He's been arrested for domestic terrorism. These are exceptions. There isn't a huge... I think right now most people know that this is a serious problem. And conspiracy theories do tend to fester, especially when you got tight-knit, everybody's in lockdown like this, and the only way they can really sort of talk to each other now is on the internet, and everyone's going to be, it's not bad yet, it'll get bad. Probably this, I think this is 4 weeks from starting to ebb, and maybe 6 weeks that we're really starting to hopefully really get out from it. That'll be long before I think we have too many problems with conspiracy theorists, but we get them. The real problem is incompetent lawmakers who, on occasion, get elected more because they tick off the other side than because anyone thinks they're competent or representative of the common man. Someone who uses a golden toilet, who orders and uses a golden toilet, isn't representative of the common man, and everybody knows it. Let's stop pretending about I'm not bitter. But All of these mortality numbers and the things that we've been talking about belie several problems, which is there are a lot of consequences from the virus that are fatal to a great many people that aren't included in those mortality figures. If you have a need for dialysis to stay alive in Italy, you've got a very serious problem right now. A, it's hard to get in the hospital without getting the thing, and B, it's hard to find a doctor who's got time for you, even if it is life-threatening. They have more people dying than they have doctors to be able to deal with it. If you have dire need of a heart transplant or a kidney transplant, they're not doing those right now. They're not. The lists have stopped. They're not taking the organs. No new organs are coming in. The doctors who would normally be doing those are a little busy with other things right now. So there are people who are going to die of organ failure, and it's going to go down as a death of organ failure, but that have been alive if COVID-19 hadn't have spread. The reason they've died is because the hospital's not prepared to deal with their particular issues. If you get any other kind of infection, if you're dealing with a staph infection, you could die of a staph infection despite the fact that you got it in the hospital while you were dealing with COVID-19 or some other disease, and nobody was prepared to help deal with that. In a state of near total collapse of the medical system in Italy, previously manageable, easily treatable conditions have become potentially life-threatening. And unfortunately, those are the more severe of the consequences, but there's a great many other people haven't thought of. Cases of domestic violence are going up worldwide. Why? Any number of reasons. First of all, a number of the things that cause, or I shouldn't say cause, contributing factors to domestic violence: unemployment, alcoholism, boredom, close proximity for extended periods of time. Guess what happens here? Then people who find themselves unemployed often go and resort to alcohol. In fact, one of the best indicators of alcoholism is employment. 2013, they found that as unemployment rises, so does alcohol abuse, and so does abuse of domestic partners. Now, they're stuck in a place where they really can't do anything or say anything. People who are being abused by a spouse, they're not going into work, and so nobody's going to see the black eye. Nobody's going to see the bruises. Nobody's going to become suspicious of anything. In fact, Oregon State's Child Safe Line has gone down from 700 daily calls to less than 300 daily calls. Child abuse reporting is plummeting. Why? Biggest reporters of child abuse are the teachers, but the teachers aren't being exposed to the students anymore. In Italy, reports of child abuse and domestic violence have dropped 55%. There isn't a health official anywhere that thinks that this is because the numbers are going down. They're going up. In Australia, the Google searches for domestic abuse up 75%. In Fort Worth, Texas, they're seeing 4 times the number of victims of child abuse coming into the hospital. But the reports are going down because the people who are the victims or who might know about it but could report it are trapped in close proximity with the abusers. Abusers who often, by the way, monitor the communications of the people who are abused. That includes cell phones, computers, who they talk to, where they go, and they can't go outside. They can't go anywhere. The problem is so severe that in Spain, they've actually developed a code word. Victims of abuse can go into a pharmacy and request a mask 19. This is a code word. They hand over their information, where they live, so on and so forth, and the police will come. France has followed suit and issued similar code words. This has resulted in a 36% increase in reported domestic violence cases. They've even made 20,000 hotel beds available for victims to stay in during the crisis. Now, that's a decent start. In the U.S., we don't take this kind of thing nearly as seriously. So you have many victims who are in the nightmare scenario of being literally trapped with their abuser. Oftentimes, the police come, they maybe book the spouse and then let the spouse go. And where are you going to go now? Half the country, 80-90% of the country's in lockdown. What are you going to do? And what if the spouse has a firearm? Because now, when they come back from getting booked, they're going to be really upset. I think these are things for people to consider. I think there's a lot of out of the box. We look at just the numbers, and we don't look at the other consequences. And we've talked about some of the benefits, actually, believe it or not, of what has happened across the world in regards to this. It's been a long show, and I apologize. And I apologize for being a little out of breath and having it be disjointed. But I hope we have, as always, informed you and helped you think a bit more about the consequences. In time, education is seen as the silver bullet. And talking about these things and bringing them to light isn't easy, and it isn't fun, but it is important. Hopefully, in the next couple of weeks, New York is going to peak in about 2 weeks, and that's going to be very, very bad, and we will be covering it. In the meantime, hopefully the other states have moved enough to limit the losses, and hopefully they will be on the lower end of those numbers that have been projected, between 100 and 250,000 in the U.S. The world is bigger than the U.S. There are other countries, and even if we can limit our losses to that, Italy has been decimated by this, and we need to be aware of, more than ever, our fellow states, our fellow countrymen, but also the other people on this planet who are suffering not only the effects of this disease, but the effects of living under a dictatorship, living in poverty, hand-to-mouth, living in starvation, living in slavery in one way or another, and that these are all our brothers and sisters. And remembering that, in knowing that, is the first step in doing something about it. My name is Nicholas Lamar Soutter, and this is In Time.